we have now had excellent perspectives from a wide variety of medical doctors and natural scientists. We are now going to be listening to an economist bringing a very, very important perspective. So I think all of you have seen the map of the globe, where you kind of put an epicenter sort of north of Vietnam, and then you make a circle reaching out west, encompassing India, reaching out east, encompassing China and Japan. That is half the world's population in that zone. So unless we get Southeast Asia with us on this journey, we are basically, we're not going to make it. So we have the privilege here of having Erik Berglöf here from Beijing. Mm-hmm. Welcome up. He is chief economist with the Asian Infrastructure Investment Bank. Ground Zero, Asia. What are you doing to get Asia on board? What is it doing itself? Erik Berglöf, the floor is yours.
Let me get my clicker.
Clicker is here. Hmm?
So it's not going to be an easy task to match the previous session. It was wonderfully exciting. So I'm going to try to make you excited about infrastructure. See, I'm going to show you some pictures, and going to be you're very excited by that. But let me see what I can do. Now, first of all, I need to. So we are an infrastructure investment bank. So it matters a lot. You know, what do we mean by infrastructure? And I'm going to try to give you a sense of, from 4 publications that we have made, of how we have tried to reimagine infrastructure, given the challenges we are facing in terms of climate change, nature loss, biodiversity loss, and of course the whole challenge to human health that comes from that. Maria spoke about this. This is another way of looking at it. You know, Asia is home to over 60% of the world population, and it is that's where the battle against climate change, and I would also nature loss, biodiversity loss, will be won or lost. The largest emitter is China. The 3rd largest emitter is India, and if you look at the future, India will soon, or not soon, but at some point most likely become the largest emitter because of the population growth. And China, which is doing a lot, as you know, to try to address climate change, but it also has a demographic challenge. So merely by the fact that the population will more or less half by the end of the century, its carbon footprint will go down for that reason. But I'll look now here at some things that I want to convince you of. So the first thing is that almost all infrastructure today is about climate, nature, and health. And we need to think about nature as our most important infrastructure to sustain life on Earth. Nature, we can invest in nature, we can manage nature, we can make nature more resilient. And the third thing I want to convince you of is that we need to integrate planetary health into all infrastructure and think whatever we do, we need to have one of the sort of performance indicators is how much are we helping to address the planetary health problem. I'll say a little bit about something that is very important to Asia, but I think it's also important globally, and this is about these global value chains that are really about trying to impose standards along the value chain so we can use them to decarbonize and help countries develop. So here's just a picture of infrastructure. You know, the infrastructure has grown a lot, but it has not grown fast enough because we need a lot of new infrastructure to address the challenge from climate change and biodiversity loss. And it's calculated that we need between 3 to 6 trillion every year until 2030 just to meet the global climate targets. And of course, there are other investment needs that we also need to think about. So what do we mean? And I'm going to talk now about nature as infrastructure. So we have a traditional gray infrastructure, cement, steel, and so on. And on the other side, we have what you call natural infrastructure, and that is both what I would argue you need nature-based solutions and what I would call really genuine nature as infrastructure. In between, you have combinations where you try to use some gray infrastructure, combine it with nature as infrastructure. But I would argue that if we start looking at nature as infrastructure, not only is it a very useful metaphor, but it also brings a lot of tools that we know how to use when it comes to raising finance and implementing change. So instead of thinking of infrastructure as a sort of challenge to us, it is how can we make it our friend? How can we make it really achieve these targets? And when we look at infrastructure solutions, we should look at nature first. And this is the commitment that we are also making as an institution now, that we are, whenever we look at a particular infrastructure solution or a problem that we want to solve, we should look at nature first. And when we're investing, we should look for nature-positive solutions, not just at the level of the individual project, but for the system that we are trying to help restore. And again, nature's infrastructure is really about investing in the ecosystem as such, and integrated ecosystem, making them reach their true potential. I'll give you a couple of examples of what I call nature as infrastructure. And you've already seen quite a bit about mangroves, and I will give you some more. This is just a small study that we did of one particular function that mangroves have, which is about protection against tidal waves. We know that mangroves have tons of other benefits, storm surges, for fish spawning, it has some direct health benefits, some medicines that come from mangroves, and so on and so on. But this is just going to focus on the tidal waves. And what we can show is that, yes, these are quite effective protection against tidal waves, but they are particularly effective for the poor people, because rich people often have other ways of protecting themselves against these waves. The sad thing, though, is that it's also the poor who are leading the sort of degrading of these mangroves, because they need it for firewood and for building material. And on top of that, they predominantly live in areas that have poor governance, so where these rules of how to manage these mangroves are not enforced. So we need to think both about how can we really make sure that these rules are enforced, how can we stimulate the preservation and upgrading of these mangroves. Another example is a project that I think many of you have heard about. It was a project called Sunbay, the Three Norths. The idea was, and this started already in 1978, the idea was to prevent two deserts from merging in northern China. And it was an incredibly ambitious project, very Chinese in style. People went out and planted these trees in long rows, like military approach, and it was a disaster. It was the wrong type of trees, they planted in the wrong way. These trees needed a lot of water, there was not enough water. It was more or less a disaster. But then over time, and there has now been two phases. So in the second phase, things improved a lot. They started working with local communities. They started bringing real science into this project, and they learned that you need to have a variety of trees. We have to, the thing that best binds the sand is actually a grass, and a grass that should be, and that this learned from the local population, that it should be planted in a particular way. And then now it's on its third phase, and it has also learned how to put as part of this plans that really give the local population sources of income, and it has also become much better managed. And we can show by looking at counties along the perimeter of this project that this has had a very real impact both on the tree coverage, but most importantly on these sandstorms that have been so devastating. If you have seen, if you travel in China in the 80s and 90s, you had these sand hills building up inside your windows, and when it's interacting with air pollution, it became very toxic, and of course that became an even more problem as air pollution deteriorated in China. So now this has been probably the single largest afforestation project, and it has had a very significant impact, not actually just on those border areas, but all through China. Actually, this project has been successful. So we started looking more broadly now at the sort of planetary health. So this was a lot of focus on nature and climate, but I don't need to explain. You heard a lot about planetary health. But what you may not realize is that when we look at health outcomes, about 10% is determined by the health sector. So it's most of what affects our health, and that's been, I think, very much the message of this conference so far, is from the environment and, of course, from genetics as well. And for an infrastructure bank, and when you want to think about the infrastructure, what you can do is actually these factors are like four times more important than what the health sector can do, what we can do when it comes to energy, how we produce energy, how we solve transport solutions, how we deal with water, how we use digital infrastructure to address some of these challenges. So here's a slide that just tells you that this is looking at air pollution, but if I looked at water quality, it would be the same picture. It says that, it reminds you a little bit of the problem that I mentioned with the mangroves in Indonesia, that, air pollution doesn't really affect the health of people so much in rich countries, but in poor countries, it has a very devastating effect. And of course, I live in Beijing. Everyone has an air purifier. All the cars, of course, are equipped with air purification. But if you don't have a car, if you don't have an air purifier in your home, it's very hard for you to protect yourself against air pollution. Same for water.
Sorry, Erik, do you know what? I think if you stand here, you can see your slides, because then the microphones work better.
Okay,
because
I'm
they
sorry.
are kind of here. No, because it's so interesting. I want everyone to hear.
Yeah. No, so sorry about that. So when you look at what China did, because China had, as you know, a very serious air pollution problem, and particularly in Beijing, and you would remember the Olympics, where they really tried to clean up. And what happened was that, of course, they closed down a lot of plants or forced plants to change what type of technology they used around the Beijing area. But initially, this just led to this pollution shifting to other parts of China. And it was not until they really invested in infrastructure that allowed you to trade across provinces for electricity, when they changed the environmental legislation, when they changed the incentives of individual managers, made environmental performance part of their compensation and their career progression. That's when it really started biting, and when the overall pollution level in China came down. And there are different calculations, but it said that China lost about 10 years in life expectancy from air pollution, and have now regained about 4 years. So it's still an issue, but it's much less of an issue. We also looked at in India. So India has a very serious issue. Of those of you who go regularly to India, you'll see also how it has deteriorated over time. But so in Delhi, they have introduced these shutdowns. So basically everything shuts down when it goes above a certain level. And what happens then is that, you know, of course, the level of pollution comes down. It's a very costly way of doing things. But what we can show is, even though this is a relatively short period, it has an effect on birth weight. It has an effect on the infant mortality. And so there is, this is a very real issue. And I would argue that air pollution was a driver of all the change that came about in China in terms of this whole green transition. And I think air pollution will be at the core of change in much of the emerging and developing world. Yeah, I probably won't come to go into this, but we looked also at heat and particularly focused on Southeast Asia. And of course, we had some very interesting presentations on heat. What we find is that heat is, of course, affecting elderly much more and children much more. And access to medical facilities nearby really help to reduce the mortality from or impact from heat. So the message basically from this report, I went through very briefly here, but it's, yes, we need to invest more in the health sector, particularly primary health, to solve the challenge that we have during COVID. And we need to build a resilient and also reduce the carbon footprint of the health sector itself. But really, for us as an infrastructure bank, we will always be relatively small compared to, for example, the World Bank. For us, if we can do things about health through the other things that we do, the things that we do when it comes to financing new technologies in renewables, what we do in terms of coming up with better solutions to transport problems, the things we do when it comes to investing in water. And also, of course, digital infrastructure is going to be very important to address some of the health issues. But finally, if we invest in nature's infrastructure and really take this seriously, that we can rebuild the ecosystem using health determinants as drivers and sort of motivations for why we make these investments, that's going to be critical. One very last word on how, because I mentioned it with global value chains. So global value chains is something that we all have heard about, but it's extremely important and probably the most important driver of economic development in China or in Asia, but also in the rest of the world. So what has happened is that these global value chains used to be predominantly in the advanced economies, but over the last 20, 30 years, there has been a dramatic shift to emerging developing countries. So for some of this has been dirty production being moved outside the advanced world, but it also becomes a very important way for countries to join different development paths and being part of international production arrangement. And the key to these global value chains are these lead firms that impose standards and drive the changes and make it more efficient. And the argument that I want to make is that if you really want to get a quick change and if you want to get these part of the world to decarbonize and address nature loss, we need to work with these global value chains. So we must not destroy them because they are extremely important for driving change. And so it's both about working with these lead firms and using common standards, having data transparency, but it's also very importantly to think about these countries. But these countries, they can now often offer opportunities to decarbonize and attract these investments that will help them develop by offering green power or by offering more environmentally and circular economy production, by offering multimodal green transport system. It's all about infrastructure. All these changes is about how we use infrastructure to drive this process, and this drive to be part of this global value chain offer reasons for countries to make this kind of investment. So maybe I'll summarize what I tried to say. We need to think of infrastructure as not. I focused a lot in the past on the impact of infrastructure when we, build it into pristine areas and so on. We need to think much more about how can we use infrastructure to address these global challenges, and how can we make sure that when we want to fight climate change, adapt to climate change, and reverse biodiversity loss, that's where we need infrastructure. We want to build into, when we measure the outcomes and we give incentives to those making these investments, that the planetary health should be part of the measurement of the results, and these should be used as tools to achieve the impact on health. And finally, as I already, particularly in Asia, but also in the rest of the emerging and developing world, using this global value chain has very strong incentives for these countries to implement these investments. And it's really all about infrastructure. Thank you very much.
Fascinating stuff. We will come back to that. But we are now going to move from mangroves in Indonesia and the air quality in Delhi. We had a gentleman from Delhi here.
Yeah.
Yes, air quality in Delhi.
Better now with some rains, but a few days back it was 500. AQI was 500.
Okay, yeah, we got the direct report. So we're going to move from there up to northern Sweden first. We have the Sami population. How many of you have heard about it if you're not Swedish? It's our indigenous population and their knowledge of snow, which I think is fascinating, because snow is not just a physical state between ice and water. Snow crystals can take many shapes, and the Samis are dependent on knowing about the exact shape of the snow for the reindeer grazing. Can they move on the snow? Will they fall through? What's it going to look like? So how many words for snow do you think they have?
100.
Yeah, between 200 and 300. Apparently some dialects that have almost 500 words for snow. So I think that is a very fine illustration of the closeness these people have had for thousands of years to nature, but also the vulnerability to climate change, this closeness. How can we make sure planetary health also encompasses indigenous populations? And we are now going to Canada, to the northwestern provinces of British Columbia, where hundreds of communities of First Nation and Inuit populations. You spend your time with them, and you're going to talk about encompassing them in the Planetary Health agenda. Welcome.
Thank you.
Yes, thank you for the introduction and all of your wonderful, solid facilitation. Lots of people commenting and complimenting your work over the last couple of days. So the title of my talk today is on the possibility of decolonizing planetary health. And I will, thank you. Exploring new geographies for collaboration. And I work as a technical director with the Indigenous Center for Cumulative Effects, which is a small not-for-profit in Canada. And I'm also an adjunct professor in the Faculty of Health Sciences at Simon Fraser University, which is where I'm based in Vancouver. And this is an image of Vancouver, British Columbia, where I live. And in Canada, we are accustomed to acknowledging the traditional and unceded territories of the First Nations on which we live. So this is the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. I wanted to thank, there's a number of co-authors that contributed to the paper that I will touch on today. And particularly, I wanted to just acknowledge my colleague, Dr. Cliff Atleo, who's in the Resource and Environmental Management faculty at Simon Fraser University, and he really encouraged us in the paper to think about decolonization as a possibility as opposed to something that is a reality. And also just want to thank Peter very much for the invitation, as well as the Royal Swedish Academy for hosting us, and Bo for the lovely dinner last night. So we were invited to this conference to connect the dots, and I will be connecting 4 dots today around Eurocentrism and thinking about planetary health praxis, as well as Indigenous rights and knowledge in terms of cumulative effects, which is a new frame in terms of thinking about planetary health over the course of the last couple of days. And yeah, just touching on the possibility of decolonial geographies and collaborations across the globe. So I wanted to begin by, this motif that has brought us together around what saves our planet, saves our health, and really there's been a lot of health equity themes throughout the last couple of days, and wanted to just lean into this idea of who the R is in our planet and our health, and just drawing on a couple of Indigenous scholars who do planetary health work here. The first is Rhys Jones, who's Maori, who writes about our attention focusing on the incongruity of attempting to solve global ecological crises with the same philosophical and ideological and material frameworks that have created these problems in the first place. And in his work around decolonial planetary health, he draws heavily on Nicole Redvers, who's a Dene scholar, an Indigenous scholar from Northern Canada, who really has also just introduced this idea about complex problems and the worldviews that we're using to solve complex problems. And she has a wonderful book on medicine and the science of the sacred. And she really urges us to think about nature as relatives. So I was did some preparatory reading around nature as infrastructure, and I think there's a lot of interesting synergies as well, thinking about nature as infrastructure as well as nature as relatives, and drawing on some other Indigenous scholars and legal scholars that really look at nature as in terms of this connected whole. So wanted to introduce that thought today. We've been talking about planetary health. This is an illustration from Forbes that many of you are probably familiar with. And there's a lot of people doing planetary health work in British Columbia. And in fact, the health authorities in BC, which is the jurisdiction that I live in, the province in Western Canada, have introduced planetary health, public health, planetary health positions in several of the 5 health authorities. And in fact, we have a deputy provincial health authority of planetary health and water, Dr. Shannon Waters. So there's really innovative work happening within the jurisdictions in British Columbia and Canada around planetary health that's being embedded in our public health systems. And I won't go into the Whitney publication, etc., because I know we've talked about that over the last couple of days. But I do just really want to focus on this Indigenous knowledge piece as an important piece in terms of thinking about planetary health, which is what I'll be focusing on today. And there is a body of scholarship around colonization, decolonization, Indigenous knowledge, and planetary health. And this is from a Nicole Redvers paper again, where she really urges us to think about compassion and move from hierarchical practices to communities of practice. And I thought it was an apt slide for our last session of our time together, when we can come together and really reflect on the knowledge that we've learned and move from transmission to this critical analysis and relations of care. And from the disconnection that we see, in a lot of scholarship between nature and humans, to really reconnecting that space, which I think many of the presentations have done over the last couple of days. So, there's this idea of moving away from the Eurocentric to the ecocentric in this literature. And another piece I just wanted to reference also by Nicole Redvers. And this is a wonderful piece of work where she writes about the determinants of planetary health. So in your mind, you can kind of imagine the WHO social determinants of health image next to this image that Dr. Redvers has created. And she has sort of a tenfold path that she's written about with Indigenous knowledge holders that explains these 10 Indigenous determinants of planetary health, and they're taxonomized in these 3 levels of Mother Earth, the interconnecting level, and the Indigenous peoples level. So I would, I encourage you to check out her framework because it's quite a strong lens, I think, of helping understand the problems that we face on a planetary level, specifically to do with climate change. So yeah, this is a piece around decolonizing planetary health. And, we really argue that for planetary health to fully realize its decolonial potential, it has to be understood not metaphorically, but as an embodied and reciprocal component of health, and through Indigenous sovereignty and through intentional practice and research. So yeah, I'm a social scientist by training, so that will be coming out by now. So in order to strengthen planetary health through praxis, there's this renewed framing that some Indigenous scholars have been offering us. And right now I'm going to turn to just thinking about the global collaborations and thinking specifically about cumulative effects and industrial development in British Columbia, and how understandings of colonization or decolonization can really strengthen our global understandings and planetary health in praxis. So there's a lot of thought around colonization, around decolonization, around anti-colonialism, around post-colonialism. And this here is an image of Canada, and it talks about what the image is it's a treaty map. So in British Columbia and in Canada, First Nations have treaty rights, as they do internationally through the Declaration on the Rights of Indigenous People. And the historic treaties are quite relevant when we think about planetary health and some of the boundary pushing that is being done through cumulative effects work. So this is the northeast of Alberta, and sort of the northeast of BC, the northwest of Alberta. It's Treaty 8 territory, and it's a territory that has been very deeply impacted by oil and gas, as well as by deforestation. And there's a First Nation in this region in Treaty 8, the Blueberry First Nation, and they won a very important court case where they argued for the cumulative impacts of resource extraction and development on their territory. And so it was a court case between the First Nation and the province of British Columbia. And this court case has really, provided some promise for other First Nations that are impacted, their health and their lands are impacted by industrial development. And it's also led to many other nations working towards combating cumulative effects of development. And so the organization that I work with is the Indigenous Center for Cumulative Effects. So scaling down from the global and more into the local. This is a map of all of the First Nations in Canada that the Indigenous Center for Cumulative Effects has funded and worked with to promote cumulative effects assessment. And I think there's a lot of synergies between thinking about planetary health, the health of our environments, and Indigenous health through this lens. So switching gears again to my final node, I've done a lot of work around climate change and health equity, and this is an image from a report that was done in British Columbia from Risk to Resilience. And I thought it was an apt infographic to show because of the synergies between a lot of the major climate events that we've talked about over the last couple of days. And there's indigenous specific impacts like the decline of traditional foods, the significant impacts to cultural sites that we've seen in British Columbia. So in BC, there's been a series of climate catastrophes, as we've seen across the world, in extreme weather events, including atmospheric rivers that have caused severe flooding, wildfires. Lytton First Nation was devastated by a 2021 fire. The community was destroyed. 2023 was the worst year on record for wildfires in British Columbia, and it's a real like I've driven across the province by accident during these wildfires, and the impacts are really major on ecosystems and on health. And there's some excellent work happening around heat and smoke in British Columbia as well. And Jasper was also like the most recent town that was totally decimated by wildfires just last year. So amidst these extreme weather events, similar to in other places, we've had human deaths. There was a report on extreme heat and human mortality that came out a year after the heat dome, which killed over 1 billion marine animals. That was reported in The Guardian. And there was over 600 human deaths. And I know that there was 60,000 human deaths during the heat wave in Europe that was referenced. But of course, the population of BC, it's a smaller scale. It was very localized. And there's been some excellent work just around vulnerability and the ways in which climate change is impacting British Columbia that really speaks to a lot of the presentations over the last couple of days. So along with the Indigenous scholarship in North America and from Maori scholars, there's also, I have my charismatic metafauna here. Got to get the bear in to get everyone's attention. Another theme over the past couple of days, bears. But there's also Latin American scholars that have been collaborating across difference and urging us to think about coloniality and the international way in which coloniality intersects with planetary health. So I wanted to reference their work, and they're really arguing for an urgency of Amazonian ethics of care within the realm of a decolonial planetary health. So there's several scholars that are really urging us to think outside of the conventional planetary health box here. And yeah, there's also been a lot of discussion around education over the last couple of days, and I work with a couple of colleagues at the University of Northern British Columbia, including Dr. Margot Parks and Sandra Martin-Harris, and they've partnered with the Public Health Association of British Columbia and are creating a micro-credential program around planetary health. And it's innovative in that it's partnering directly with First Nations, and they're promoting land-based work, and they're doing work in community under the lens of planetary health and Indigenous knowledge. So I just wanted to reference that work that's happening. Yeah, and I think just being located north of the United States and Canada has, over the last several months, has really had many people reflecting on the significance of good governance. So along with planetary health governance, I think we need to work towards implementing the United Nations Declaration on the Rights of Indigenous Peoples. And I also just wanted to put a plug in for some of the work that I've recently co-published with John Burroughs, Max Ritz, and Susan Smitten, who are co-authors of the Raven Essays, Indigenous Environmental Justice and Education and Self-Determination. And what we've done is we've taken a series of student essays that are from Indigenous authors as well as non-Indigenous authors that are working in the Indigenous rights space, and published about a decade worth of scholarship from student essay winners. So I think another way we can move towards promoting change and climate change and planetary health is by supporting students, many of whom are here. And there's a great body of students in the Faculty of Health Sciences at SFU doing really important planetary health work. So back to one of the conference motifs, the butterfly effect. And so I'm sort of arguing for transformative practice and remapping of environmental and planetary health. And just in closing, thinking about connecting the dots, and I've connected these dots between international scholars that privilege Indigenous approaches to planetary health, cumulative effects thinking, and international scholarship that looks for possibilities of decolonial ethics of care with local examples of place-based work. So in doing so, I really hope to forge connections and future geographies of collaboration and resilience across the different disciplinary thinking to remap environmental and planetary health, including through education in a way that evokes the butterfly metaphor through sustained praxis in the field. So thank you very much.
Thank you, Dawn. Well, talking about planetary health, sometimes we need to be discussing this on a very abstract level. At conferences, systems thinking approach is very common. But how can we talk about planetary health in a way that engages and creates dialogue in a wider circle to get the butterfly effect that Dawn talked about? Julia Serong is here from the Ludwig Maximilians University of Munich to talk about communicating planetary health. Welcome.
Thank you. So yeah, thanks for having me. Thanks for inviting me, Peter, and thanks for bringing us all together, and also for having the opportunity to speak about this really interesting and important aspect of communicating planetary health now, like almost at the end of this conference, this symposium. On the one hand, I thought, well, actually, we touched upon this a lot on the first day, and it was really, hard for me to sometimes, keep in this observing role a bit, just listening what you are saying. But I hope you remember some things and aspects and questions you raised already on the first day. Perhaps we can pick that up right now after this series of talks, but also during lunch. So I'm a communication scientist, so not an expert in environmental issues, not an expert in health. So please, be patient with me and forgive me if I got something wrong when I'm touching upon any issues that fell into your field of expertise. However, you were also talking a bit about communication, and I think we all agree on the fact that communicating planetary health is absolutely urgent and necessary. However, sometimes I had the feeling that we mean different things when we talk about communicating planetary health or communicating the science and the research of it. So I just brought you to like 3 or 4 different definitions of what science communication actually is. So in a very basic, neutral way, we can say encompasses all forms of communication focused on either scientific knowledge or scientific work, so the processes behind it, the research you are doing. And I think we saw lots of great examples of your own science communication at this event by now. But of course, when you use science communication in a strategic way, it's always oriented towards certain goals. You want to reach something, you want to change something with science communication. There can be information, there can be education, there can be just raising awareness for unknown topics nobody knows about. And I learned a lot about kidney diseases, for example, at this event. And time and again, I mean, we are seeing that we don't only want to, inform the people, but we actually want to persuade them to change their behavior. Let's get into action. And this is the context in which we are also talking about framing planetary health, or developing certain narratives in order to tell the story in a better and a more effective way. However, in the context of social media, we also see that it's not only about transmitting information or getting a narrative across, but also leading a social conversation. And and this is the hardest part sometimes, it's not only about talking, it's also about listening, and this takes time and patience, and this is what we lack. It's one of the scarcest resources we have, patience. And I think all these definitions are right. All of these definitions are legitimate. All the goals of science communications are like good ones. But what I can tell you is you can't have it all. You can't have it all at once. And you can't have it all at the same time in the same room with the same audience. So we learned a lot about life is decision making. And I think it's really interesting that it seems to be a no-brainer, so you don't even need a brain to make decisions. Even the simplest life forms can do this. But actually, I hope that we use our brain when making these decisions. What do we actually want to achieve when we want to have effective science communication? planetary health communication also takes place in very different contexts. Science communication is not, just one way doing it. We have journalism, we have public relations, we have scientific policy advice, also saw great examples of that here. I see the point that we are focusing on external science communication in all these arenas, but I just want to stress the importance also of internal science communication. And this is extremely important for the planetary health field, because the trust in science, the trust in planetary health research, the trust in then also planetary health communication pretty much relies on the performance and quality of internal science communication. And I think we feel all a bit like, on the one hand, we are all on the same page. On the other hand, at least in some or other talk, we really understand, perhaps we were lost. I mean, I was actually lost in many of your talks, and it's just normal. It's not that you are a bad science communicator, but it's not just, it's about expertise and communicating the evidence in a good way. I think we need more of this internal science communication. So I learned that it's not the Key Symposium, but the Key Symposium, but actually it's also a Key Symposium. So opening up a new discourse and dialogue here. Of course, for many of you, planetary health is not only a research field, but a strategic communication approach. It's always this idea, this hope even, to see that health framing can make climate change and environmental problems more local, more short-term, more personally relevant, and thereby also emotionally engaging, especially to target groups which we would call the disengaged or even dismissive. However, there are still many, many open questions, of which I just put some here on the slide. And I have to say, it's really a pity, but I have to say that I think all of these questions I have to answer with it depends. It depends. Depends on the medium, depends on the target group. It depends on you, who you are. Are you a researcher? Are you a communication designer? It makes all the difference if it's better, to choose option A or B or C or whatever you do. However, it's not like that we are totally ignorant. We already know some facts. I can only recommend you to look at this report, for example, Harnessing Health to Drive Action. This is about, climate change communication in relation to health. And they gave this wonderful recommendation. And I more or less agree with these recommendations. I think they are, broadly spoken, good ones. However, we have to be careful when we transfer these findings onto planetary health communication, because planetary health is much more than just climate change, much more complex. So I think we need more knowledge in that. And for us at the Munich Science Communication Lab, trying to do communication research with planetary health communication, the concept of the planetary boundaries was very helpful, because it breaks down a bit, it makes it a bit more specific. What are we actually talking about? It's not only a buzzword, which we can't even use in German, but what lies behind that. However, what was a bit problematic for us, and that's one of my most important messages also to you, is that we, from my point of view, still lack a clear typology of the health outcomes. So there are different ones, and I just brought you the illustration you are familiar with. But these health impacts are changing. I mean, you can really see a development here in the last years of the Planetary Health Alliance. And for example, now they are including child and reproductive health and so on. That was quite new. Well, we were forced to use our own typology here in order to better, relate, connecting the dots between the environmental problems like climate change and pollution and so on, and the different health outcomes. And I'm pretty sure this is not the best one, but this is what we use. And also it was important for us to take up food and nutrition as well as habitability as categories in their own. And what we did was we wanted to know, what do we actually know about communicating planetary health without even using the term. So we did a scoping review of the communication and media research literature, and what we found were 213 articles, empirical studies that would connect any kind of environmental aspect with any kind of mental or physical health or food or habitability. These are 213 articles. This seems to be not pretty much, actually, so there is still a really big gap of knowledge we have here. And this is all sorts of, this is not only experiments, these are communicators, surveys, everything. This is just what I brought to you, perhaps as a feedback for you. I mean, what we see is that we have a lot of studies focusing on food. It's not surprising, actually. Mental health, mental well-being is also pretty much in the focus. Not even only eco-anxiety, but these are many experiments asking for the emotional effects. Do we raise anger? Do we instill hope, etc.? Like, we would count this among these well-being aspect. Also, of course, climate change, air pollution, novel entities, these are the big issues that we deal with. And I think this, for some of you, this is a positive feedback, but others might really have to look very closely at where are we even talking about, biodiversity and so on. And so I have to admit that my discipline, my research field, we are not covering the whole planetary health scope, but we are focusing on some issues and others are being neglected. Often we see this relationship to food that might be helpful, but again, like for example, kidney diseases and so on, we haven't looked into that yet. Also, big part of the research is US-centered. Also with air pollution, we have lots of studies from China, but scarcely anything from Europe. So this is also a problem when it comes to communicate effectively, because still our cultures are very different, our societies are different, our political communication is different. So we have little research on communication about biodiversity, land use, biogeochemical cycles, which I found really, really interesting. Also little research related to allergies, although it's really an important issue, especially in Germany. Also, infectious diseases, although we saw a peak after the pandemic in that, but that might be the typical COVID-19 peak we see in almost every kind of research field here. Also, and this is what we see later on again, is that the relation to, the connection to health is very often very unspecific and general. So we have many experiments on the perception of the health risk, but it's just health risks. And the people were not even asked, what kind of health risks do you perceive? Are you afraid of, cardiovascular diseases? Are you afraid of, I don't know, any kind of organic problems? What is it actually you fear? It's just health risks. And I think this is something we have to change. We use the same typology, the same search string, to search for news articles in German media in order to see how do we actually right now communicate about planetary health. Again, not using the term planetary health or anything like that, but connecting some environmental aspects with some health outcomes. And again, I show you the similar picture, and here we see, also not surprising, I guess, the public discourse, again, Germany, is focusing on climate change, on extreme weather related in connection to that, of course, death and habitability. So this is interesting. So habitability, like this really extreme moments, like it's life or death, actually. It's like, can we go on living here or do we have to move? Also, again, a strong focus on food issues. Novel entities, I think this is the whole microplastic discourse, which gets a lot of attention. But again, we see that some topics are really, have problems to get attention and reach the public arena here. Interestingly, also this air pollution aspect, although it's rising, especially in the cities. Also, we look, how central is the reference even, and we see that most of the news articles enter with the environmental approach. So it's an environmental problem. And what we see is that the reference to the health outcome in many cases only happens in the text somewhere, and that might be at the end of the text, where you perhaps aren't even reading any longer. And this is really a problem I see. So many journalists are coming from the climate and environmental sector, but they are a bit insecure when dealing with the health outcomes. And again, we see the same thing, that the regard to the health outcomes is very unspecific. Also, we ask, so in this coverage, not only making the dot, like connecting the dots, but do we actually talk about who is responsible, actually, in terms of being to blame for the cause, for the reasons for the problem, but also responsible in some way for the solution. So I really like the approach also Martin mentioned earlier, that we have to talk to the healthcare professionals, and so because they can actually contribute to solving the problems. Of course, they are not at fault, but they have the means to help with that. And for me, it was really amazing to see that in more than 80% of these articles we found there was no actor held in any way responsible for the problem. It was quite solution oriented, but then again, in many cases there was no actor, named who could really help implement the solution. And only 10% of the articles we have would really include attributions, both of blame and the responsibility for the solution. I think this can really be better, because I think that would make it easier for the audience also to understand how to solve the problem actually, and if what they can do and what others have to do, if it's really the politics or economy or whoever that might be. So concluding, I would say, and I hope we agree on that, but I'm really open to your criticism here. Let's say that planetary health as a concept is way too abstract for science communication to the public. Yeah, although not even because it's so complex, but also because the public is complex as well. There is no broad public. There are so many different target groups and audiences. The concept of planetary boundaries is helpful, but also very complex. And perhaps we have to look for other concepts and ways to explain that, because it's growing. We started with 7, now we have 9, and I don't know. I think there are some promising issues like food, like also habitability, but we need more communication research on that. Also, I think we really need a lively discourse about responsibility for the causes and for the solutions. And finally, I would really like to stress also the fact that it's, although I understand how urgent the situation is, and we really need researchers who engage in science communication, we have to walk this fine line between science communication and political communication, and this fine line between educating people but also persuading them, and because trust in science is really a valuable resource, and we have to be careful not to lose this trust. So we cannot make up for the problems that the political system caused, and we have to give this pressure on to the politicians that they really see their own responsibility here, and not mix up the roles we are having here. Also, I think it's really important to be clear, what do we actually know, what is evidence, what is a fact, what is still a hypothesis, what is my field of expertise, what is a qualified opinion, and what is decision-making, after all, which I think is not the mission of science. Thank you very much for your attention.
Okay, thank you, Julie. Very interesting. Our final 2 speakers rounding off. We talked about the way climate change is being treated in the news, and sometimes in the evening press you can get the feeling that climate change is driven by a few Silicon Valley tech billionaires running around in their private jets. But of course, it's much more complex than that. And often it's driven by the best of human intentions, like the health sector itself. So what can the health sector do about its climate impacts? And how can big pharma take a leading role as the new medical challenges arise from climate change, such as infectious diseases spreading more widely? We have from AstraZeneca, the proud former Swedish, now Swedish Anglo company, the country president of AstraZeneca Nordic, Emelie Antoni. Welcome here.
Thank you so much. So thank you for the opportunity to be here. Me working in pharma, it has certainly been very interesting, a bit frightening, thought-provoking, but also inspiring ways to be here. So I represent AstraZeneca, which is a global pharmaceutical company. And it's truly global in that essence, that we have 90,000 employees spread in more than 100 countries. And we work day and sometimes also day and night with developing new innovative medicines, manufacturing those medicines, and ensuring that they also reach patients in the hope to improve patient outcomes. Now, I also am chairing the board of the Industry Association for Innovative Pharma here in Sweden. So I was asked by Peter to give the big pharma perspective. So I will try to do that from an industry perspective, but most of my examples will naturally come from AstraZeneca. But I want to start with a bit of personal reflection. I grew up on the west coast of Sweden by a fjord, beautiful place. And as a child, I often went snorkeling in the summers with my brother, and we picked blue mussels in the shallow bays, and we cooked them for dinner. And in the evenings, we would go out with my father to fish mackerel. And if we were lucky, we would have a seal or two actually circling curiously around our boat. That is no longer possible. The water looks just as beautiful on the surface, but underneath it is empty in this place today. And we're only talking 40, 50 years. And that makes it even more relevant to see all of these experts joined in a symposia like this. So great to be here. So at AstraZeneca, and I would say a lot of other pharmaceutical companies, we look at a sustainable future to be fully dependent on three components: the health of people, the health of societies, and the health of the planet. And whatever we do with one of these will impact the others significantly. And we work along the whole health journey, so to speak, from prevention, early detection, diagnosis, medicines, but also follow-up and looking at the disposals of those. So for us, it's really a joint responsibility that we have to make the right decisions along this journey for a sustainable future. And if you take a look at this picture, it might be what some of us wish for when we look at how we want to spend our time as we get older. Reality is very far from this, unfortunately. It is not the reality for most. And the last couple of days, we've heard of the significant impact that the climate change has on people's health. We have heard about the impact on cardiovascular disease increasing, chronic kidney diseases, respiratory diseases, cancers and infectious diseases. And those of you who are sitting here being a little bit skeptical of me standing here, you might think, well, that's all good for business, huh? Isn't it? But as a matter of fact, we consider it to be a huge problem, because this comes in addition to what we already see happening in the world. And that is that we have an aging population. We grow older, but unfortunately, we also have more years that we spend in poor health. So already we see chronic diseases increasing as well. And this puts a lot of pressure on an already dysfunctional healthcare system in many places, where we are struggling to cope with the burden of patient volumes and also the intensity of care that these diseases require. Because most of the patients are identified too late in order to have a less burdensome intervention to be relevant. And we're talking 3 billion patients today living with chronic diseases such as cardiovascular disease, chronic kidney disease, and so forth. And then we have pharma, where we are developing new innovative medicines that are more advanced, more precise, targeted, which is great when it looks at efficacy, and it's also great when it comes to reducing the burden of side effects. But it often comes at a higher cost as well. And to introduce these innovative therapies requires a more advanced infrastructure around healthcare as a whole. So the equation somehow does not match up. So it takes a joint effort to work across the whole kind of health and patient journey in order to reach sustainable healthcare in the future. So what does companies like AstraZeneca do? Well, we look at sustainability in a holistic ways. We think we want to build a healthier future for people, society, as well as the planet. And that is a broad definition, but it needs to be broad because achieving a healthier, more sustainable future requires tackling the biggest challenges of our time, from climate change and biodiversity loss to health equity and health system resilience. And we need to do so in an ethical, transparent and inclusive way. So I will focus mostly on the CO2 part of this problem. And as we've heard during this conference, climate change will increase the need of access to healthcare. So the healthcare is part of the solution. However, healthcare is also part of the problem, because the healthcare sector is actually responsible for around 5% of all global greenhouse gas emissions. Now, to put that into perspective, that is actually twice of what is coming from the full aviation industry, which was a bit shocking news to me when I saw this figure. And on the graph here, you see how these 5% are distributed across the value chain. And as you can see, the supply chain, where pharmaceutical industry is directly involved here, together with research and development, stands for more than 50% of the total emissions, whereas care settings and patients stand for the remaining 45%. So what do we do as a pharma company to decarbonize the full value chain? Well, we were actually one of the first companies that had its net zero journey being validated and certified through science-based targets. And we have a program that we call Ambition Zero Carbon, which is a program to become science-based net zero, aligned to the Paris Agreement by 2045, and across our entire value chain. Already next year, we are aiming to reduce what we can control ourselves, so Scope 1 and Scope 2, our direct emissions, with 98% from a 2015 baseline. And we are well on track, because already last year we had reached 78%. of that reduction. And I'm really proud to see here in Sweden, where we have one of our biggest production facilities, as well as one of our biggest research and development centers, we reached 98% reduction already last year. And that was 2 years ahead of time then, huh? But what is also noteworthy is that during these last 10 years, we have significantly grown as a company and grown the volume that we produce in our factories. So we have managed to decouple our company's growth from our direct emissions. And that is a strong signal that I think is important to send to other companies and other industries, that it is possible to work for growth, but in a sustainable way. So whilst I'm really proud of the progress we've made, I'm also humbled by the fact that we are nowhere near to solve the full problem. Because the big challenge comes with scope 3, which is the indirect emissions from this whole value chain. Thank you. And this accounts for 97% of our total emissions. So it's definitely our biggest challenge. And here we need collaboration, innovation and transformative solutions to really see the same decoupling as we have in our scope 1 and scope 2 emissions. So how do we reduce the indirect footprint? Well, this is a simplified picture of the whole value chain of medicines, and we work in each and every part of this to see how we can take action. So a couple of examples. When it comes to our suppliers, raw materials and so forth, we set the same standards, high standards on our suppliers as we do to ourselves, and we expect 95% of our suppliers to have science-based targets this year already. We also help them with access to renewable energy. We have, for example, all green energy here in Sweden. But we also look at green design of our products, green chemistry, circular solutions. We use leftovers, spill, and waste to go back to suppliers as new raw material, for example. We shift our distribution chains to be more sea and rail versus air. All of my staff here in Sweden have electric vehicles. We managed to get that through this year, as an example. We also have CO2 budgets, so we have to be prioritizing and picky when we choose where to go and how overall. And then when we come to patient care, we do a lot of things with, for example, replacing propellants in our spray inhalers, which is a huge burden currently, where we can reduce one device greenhouse gas footprint from 14.5 to 2 kilos on just one device. So we can make a significant difference overall. But I also think it's really important to recognize that the decisions that are being made for each individual patient are super important for the overall healthcare emissions of CO2. So this is some data coming from NHS, where basically, in a nutshell, you can see that the more severe disease and the more a disease has progressed, the bigger the burden for both the patient, of course, but also the healthcare system as well as the environment. And this speaks to the importance of working with prevention and earlier detection of disease and the right diagnosis and the right treatment at the right time for each patient, to stay to the left as much as possible on this graph. And I can give a few examples. In asthma, for example, an uncontrolled asthma patient has 3 times higher CO2 emissions than a well-controlled patient because they use so much rescue inhalers. That is also NHS data. And another example related to what we heard yesterday about the chronic kidney disease project we've done with Region Halland here is to look at CKD patients, chronic kidney disease patients, where we see at the burden on each individual patient is around 0.5 ton to 1 ton of CO2 per patient a year if you're in the lower stages of the disease. But when you progress, and this is a progressive disease, you can get even up to 6.6 tons if you're in end-stage renal disease requiring dialysis, for example. So also speaking to the importance of prevention and early intervention for patients. Just a very few sentences around the Sustainable Markets Initiative, where AstraZeneca is one of the first companies to join to accelerate the delivery of net zero healthcare. And here it's a lot about partnerships to drive change and to role model the right type of decisions and behaviors. But it's also about education, for example. So one of these projects, there has been an educational effort for medical students, 15,000 medical students, and where we have also included Lund University so far and hope to do the same with Karolinska Institute in the future. So change is possible. And I think I just want to mention the work that we're doing with PHSSR, the Partnership for Health System Sustainability and Resilience, both with London School of Economics, World Economic Forum, and here in Sweden we're partnering with Stockholm School of Economics to really drive change in terms of sustainable improvement for healthcare systems. So if there's one thing we have learned across this, I think that these type of meetings that we are today, connecting the dots and working together to take the right actions, make the right decisions, and drive change, a positive change together is the way forward. Thank you.
Thank you, Emelie. Thank you very much, Emelie, with the industrial perspective. We have some swift changes here in topics, introducing our last speaker. I spoke to you last week, and you were sitting in a dark room in
Dakar.
Dakar,
Yes.
of course.
Discussing planetary health, in fact.
Discussing planetary health. So this is Ole Petter Ottersen, who used to be rector of Magnificus of the Karolinska Institute. You've also been the same at the Oslo University. You are a doctor. Tell us how we're going to break the silos now and start working to...
I will reveal all the secrets. By the way, Karolinska Institute was a partner in SMI, Sustainable Market Initiative, from the very beginning.
I know.
So we were already there collaborating with you. So, I have to have the gadget. Thank you.
Titta,
precis. Yeah, sure. So obviously I should not be here because I'm a neuroscientist working on delicate small molecules in the brain. So why on earth, literally speaking, should I stand here talking about something quite different on an entirely different level? But being a neuroscientist, of course I can tell you with some evidence that problems that start in the brain, but the same thing is true for solutions. So I dare say that my past is, after all, relevant for this particular presentation. So, yes, what should be the first thing to say? Well, the topic of this meeting is, of course, extremely challenging, because we all know that knowledge when it comes to the challenges that we're facing is increasing by the day. But still, we don't see that much hope when it comes to change at the governance level, not least. I will come back to that very, very soon. I think, Martin, where are you? Martin Schalling? Yes, you said in the coffee break that, you know, it all goes to hell. We know that we cannot come up with solutions. Yes, I was a bit depressed.
It was a brief summary.
Yeah. But I will try to convince you that there is some light in the end of the tunnel. If we look at, as I said, governance, we must improve governance when it comes to these issues. Education, but also what we call, well, it's our term, in fact, counter-innovation. To come up with innovations that, in fact, could rectify some of the innovations that have led us astray and onto an unsustainable path. So I will just tell you that after leaving Karolinska Institutet, I was so interested in pursuing the One Health perspective that nowadays I spend more than 50% of my time dealing with exactly the problems that we are discussing here today. And the lens, we talked about communication, Julia, the lens that we are trying to use for communication is the One Health lens, that I think in a few years from now perhaps will be one very efficient lens of communicating to decision makers and to the society at large, that yes, we have a situation where animal health, planetary health, and human health are so tightly interconnected that we have also to attend absolutely to the climate health nexus and the nexus between human health and animal health. And in fact, talking about Dakar, one thing that is so important, this is from a meeting we had in Africa on climate health, it's so important to include the perspectives from the global south. I personally have learned so much from being part of the African Population Health Research Center on the board there, to really experience how those that really are affected by climate changes and environmental challenges, that is populations in the global south, how they experience the challenges that we are discussing here now. Just let's look at one of the slides that our colleague here presented in Africa. Look at some of the findings that we very often don't really attend to. The whole fabric of life is distorted by environmental changes and climate changes. For example, children will be undernourished due to climate change risks. Look at the figures. It's absolutely devastating to see how the topic that we're discussing today will impact the fabric of life in the global south. So, in fact, communicating the challenges that we are seeing, going back also to Ingvar Ernberg, he talked about the networks, but I would say that the whole fabric of life is under pressure and will be impacted by the challenges we see. And of course, we're talking about geopolitics now. We cannot discuss these issues without going into the geopolitical changes that we see. And they are, of course, pretty depressing to see how now, for example, US is withdrawing from very many important initiatives when it comes to planetary health. But again, governance is so important. When I was president of Karolinska Institutet, we were very, very keen on, leaving a sort of mark on the discussion as to what kind of governance do we need when we have health crises like COVID-19, but also the climate crisis that we are going into. And this is a topic, governance for health, that I think we should be much more attentive to, because it's absolutely important to translate all the different kinds of knowledge we have into better governance. So it's not only a thing of communicating this to the public at large, to the society at large, but not least to critical decision makers. And this is something I will go into now. Because what we did just 3-4 years ago was to establish a network of academical institutions, but also NGOs, called One Europe for Global Health. And one here relates not only to Europe, but to health. So One Health for 1 euro. And in fact, what we have tried to do to really translate knowledge into better decision making is to invite every new presidency of the EU Council that changes every half year, as you know, to really try to communicate again the challenges that we are seeing based on proper science. And in fact, in 2023, we had this meeting in, this doesn't work any longer. Well, we had this meeting in Karolinska Institute, you can see the Nobel Forum there, where we discussed exactly how we should proceed when it comes to make decision makers more aware of the increasing knowledge that we have when it comes to not least the climate health nexus. So, what is needed? My task is, of course, to say what can academic environments do. And what we are doing now is, in this particular network that I'm talking about, address the challenges that we are discussing here with many different angles, from many different angles. So one, of course, is the impact on society. We are looking at the food and nutrition issues, the global health issues, access to healthcare, governance not least, and also then, again, very attentive to what happens in the communities that are directly affected by environmental challenges and the climate crisis. So all of these working groups, their aim is simply to translate knowledge into better governance. And we have tried to engage in the debate, not least trying to get EU to change its ways, because still we see that EU is not really pursuing policies and politics that really address the challenges that we are discussing here. Well, positive things are happening. And one thing that perhaps you have realized is that in Europe now, in EU, there is a fantastic movement towards having a better communication and interaction between the different domains that have to do with the One Health perspective. Like what you see here, this was news last year, where the European Centre for Disease Control and the EMA and also the European Food Safety Authority understood that they had to be much, much more integrated in policies in order to connect the dots, as it were, also at the governance level. So one very, very important obstacle when we talk about One Health and the interconnection between climate health and human health and animal health is data. And what we realized in a research project that we carried out in Africa was that, in fact, we are not still in a situation where we can couple and structure data from climate, animal health arena and the human health arena in an efficient way that allow political decision makers to arrive at wise decisions. So we as academics, we have really to step up to try to understand how data from these different domains should be better connected and structured so that political decision makers will have a platform for better decisions. I mean, this is a very, very urgent thing for us as academics to address. And one thing that we propose is that we should move from institutes that are specifically addressing, for example, human health, to institutes not only at the country level, but also at the regional level, that really address the One Health perspective. We call them One Health Institute. They don't need to be brick and mortar institutions, but we have to ensure that we have, in fact, expertise that can cover all these three different domains in an efficient fashion as a platform for better decisions on the part of political decision makers. Just a few comments on education. We as academics, we have to be self-critical. I guess that some of you at least, have read this article that came out last year. They looked at more than 18,000 universities at the energy master programs, the master programs for energy. And 68% of all these energy master programs, that they are still focused on fossil energy. What does that mean? Well, we don't have any sufficient capacity, knowledge among our candidates to really push renewable energies. We have to be self-critical. So in fact, we have to change our ways as universities. We have had quite a lot of meetings with the students on Karolinska Institute on these issues, how to, in fact, have educational pathways or curricula that are inspired by the Sustainable Development Goals. Again, we have to be self-critical. In the medical studies, for example, we still are very much influenced by this Flexner report that is already more than 100 years old. A biomedicalization of health. Rather than what is needed, we need transformative skills to look at health in a more One Health perspective. And what we just wrote a couple of years ago is that we don't need just transformative skills, but what we call sustainative skills among our students. Students that really understand how health, including planetary health, should be investigated and carried forward through the One Health lens. It's a huge change that is needed in the medical curricula and in the curricula also in other fields. The final point, just 1 minute, is then devoted to what we call counter-innovation. You know who this is? It's a quiz. It's a chemist. His name is Thomas Mitchley. He was an academic, and what did he do? He invented or discovered what he called a miracle compound, freon, or chlorinated fluorocarbons. So, these very harmful substances came out of universities and science. And what we know is that, that's also a miracle. One of the planetary boundaries that Johan Rockström talked about, the stratospheric ozone depletion, is not any longer something that transcends the boundaries because it's in a safe place. Why is this? It's because of counter-innovation. It's because of these three people, not least, who won the Nobel Prize in 1995 and understood how ozone is being depleted. Well, the refrigerants, the chlorofluorocarbons are the culprits, and how to deal with these particular challenges, and we got the Montreal Protocol. So counter-innovation science, Martin, there is hope because science has shown us that we can deal with even quite substantial challenges. Yes, I should ask you who this was, but I was too late. A professor in physics, University of Oslo. He, in fact, handled another global challenge. Do you know which? Again, counter-innovation. You remember? In the end of the 19th century, there was no more, saltpeter, nitrate, that could be harvested from the mines. And the entire agriculture sector was challenged because of the lack of artificial fertilizers. Then he found a way to extract nitrogen from the atmosphere. And nobody remembers even this global challenge, but it was solved through science. So this is just the 4 points that are raised. So I won't go into this again, but I will just say that we have fantastic academic possibilities here in Sweden with this new network called SHIP. And also I should say that Stockholm Trio, which Karolinska Institute is a part, is doing a great job in addressing these very pressing issues. So thank you for your attention.